welcome everyone to today's DHCW Digital Governance and Safety Committee. And I'd like to welcome Martin Williams and his data. Great to have you, Martin, as part of the data management for the information services. And you're deputising for Rachel Powell. I'm sure will do a great job. So you're very welcome. Thank you for stepping in and covering Rachel. In the interest of time, usual rules apply. I'm not going to go around and get introductions to everyone here and now, but perhaps the first time you speak, if you could introduce yourself and when you present an item or ask a question. And just one of the kind of things I like to remind everyone of, this committee covers a lot of quite technical topics, and we use a lot of abbreviations and TLAs, three-letter acronyms. If you could just spell them out, we are recording the meeting. This is public, and we'd like people to be able to follow along. Apologies have been received from Rachel Powell, who we missed, but Martin's covering, and also Chris Darling, who's Director of Corporate Affairs. We won't miss Chris either because Laura Tolley is stepping in for Chris, and she's also a very safe pair of hands and will do an excellent job. Just to remind everyone that there is a private session at the end of this meeting. During the private session, we cover some of the risks that we wouldn't want bad actors who perhaps don't have the interests of the citizens of Wales interests at heart, and we discuss those in private, and we will provide an abridged version of the minutes of that meeting at the next committee. The committee papers are uploaded on the Digital Health and Care website, so if you want to follow along or reference some of the documents that we present in the meeting, you'll find them there. And as I said, the meeting is recorded and is posted on the website. Finally, we have got a lot to cover in both sessions today. There will be a 15-minute break. We are aiming to finish the public session at 15:50. So that is my challenge to keep us all to time today, or 15:05, I think, with a 10-minute break, so that the private session can start at 3:15. So with that preamble covered, can I move to item 1.3 on today's agenda and just ask for, are there any declarations of interest that need to be made on the meeting? Everyone's had time to see the papers and review them. None? Okay, in that case, we'll move on and step on to matters arising. Is there anything that is urgent that needs to be discussed today that isn't on the agenda? Very good, in which case, with those formal matters dealt with, let's move on to the consent agenda. There were a number of items that we're dealing with on the consent agenda. I'm just going to step through each of them just to make sure that everyone is pleased to approve the minutes of the last meeting, both the public and the bridged. We all accepting those? Excellent. Can I ask the minutes to note that we've approved minutes? The forward work plan was available. Was there any comments on the forward work plan? No, in which case we can note those as well. The Digital Governance and Safety Committee annual report. Any comments on that? I've got one. I thought it was a real pat on the back for everyone whose hard work goes into this committee. So thank you for everyone who does this. It's an important job, and it's not always the most interesting or the stuff that gets talked about, but this is where information is protected, and you can't have a trusted digital healthcare service without the work of everything you do. So thank you for that. And anyone following along and listening to the recording, please go and have a look at the annual report. And for the one member who made nice comments about me You get no extra marks. These were all anonymous comments, so you know there's no merit in that. And for the rest of you who didn't, well, I'll take it to heart and try and improve in the future. Okay. So, Digital Governance Safety Committee Effectiveness Self-Assessment, we've covered that as well. The terms of reference, did anyone have any comments on terms of reference? No, very good. And the the Digital Governance and Safety Cycle of Business. Is everyone content and noting of that? Okay, well, in that case, let's move on to the main agenda. So the action log, I noted that there were two actions from the last public meeting, and the log shows that both of those actions are complete. So thank you for that. And I'm going to move now to 3.2 and ask Laura Tolley, Head of Corporate Governance and the Deputy Company Organisation Secretary, to lead the discussion on the risk register. Thank you, Laura.
Diolch, Chair. So, yep, Laura Tolley, Head of Corporate Governance at the HCW. So I'll just present the risk register. In terms of the risk register itself, it has 11 risks, 7 of which are for the consideration of this committee. 5 of those are public, so we'll discuss these now, and then the remaining 2 will be discussed in the private session a little bit later. Since the last reporting period, one committee assigned risk has been removed, which was DHCW 0335, which was the service delivery agile process risk. So work on this has now been completed and mitigation in place, so that was successfully closed. There's one new risk assigned to the committee since the last reporting period. That's DHCW 0340, GP systems and service provided by a third party that could be withdrawn. Members will be familiar with this risk, but just for the benefit of the committee, I'll just remind members that on the 10th of December, we were made aware that IMPF, as a subsidiary of Segedem, had voluntarily placed itself under administration. So IMPF supply Vision, the software for our core GP services for 154 GP practices across Wales. So the business of the company continues to trade and is maintaining a full service to minimise disruption to end users, whilst they just look to secure a new buyer for the company. Continued service is our highest priority, and the team have set up 4 work streams to manage this, and we have regular engagement with stakeholders and other NHS nations. In terms of the current status, the team advised today that we're aware of one preferred bidder and we're just waiting for negotiations to commence. Whilst we wait, there's significant amounts of preparation work. So we've scoped a contingency plan should a buyer not be secured. However, you know, despite a few sort of changes to contracts and terms, getting a new deal is the preferred outcome. Obviously, it's commercially sensitive, so unable to share any further details on that at the moment. So we are reducing the risk weekly by 2 practices using the existing migration plan. So we're now currently on 146. So that's the current status of that risk. For the remaining risk, so it's Rydian, do you want to come in on this one in particular?
Yeah, Chair, just so you know that the responsibility of business continuity, should a software system goes down in primary care, sits with the service provider, not with us. We're obviously doing everything that we can to support should a thing happen, whether it be withdrawal of software for a commercial reason or indeed a cyber attack. But ultimately, the service continuity business plans are the responsibility of the health boards and primary care, and they're aware of that.
Thank you, Rydian. That's very helpful.
Thanks, Rydian. So for the remaining risks assigned to the committee, so we've got DHCW 0300, that's CANISC. So this risk remains under close review as the decommissioning of this progresses. and DHCW 0336, so the audit plus withdrawal. And I know that the commercial team are working with the legal teams to negotiate terms for the extension. Before I go on to the other two risks, Chair, if I can, I'll just see if Rydian wants to comment. Thanks.
Thanks.
Please,
Chair, you're aware that the Canis had replacement decommissioning had three parts: the dependency of the cancer service, the dependency of colposcopy and screening, and the dependency of the palliative care. Obviously, the cancer service is off Canis. Colposcopy end of this quarter, and palliative care end of this quarter. We anticipate that there will be probably a 4-week overspill into Q1. This is relating to a number of factors, including releasing clinicians to test. This is a perpetual problem of all our programs, and you'll have heard me say before that it's not until a product is on the horizon that the ducks are lined up with the staff who are having to do their day job and also test this. I'm grateful to Sam Lloyd and the cyber team have recently provided information regarding the risks associated with continuing the product, and we're cognizant of the necessity to get off it as soon as possible.
Thank you, Rydian, and maybe some colleagues will come back and ask some questions on both of those. Let's just go through the risks, and then we can have a rounded discussion across them at the end, Laura. But thank you for that colour, Rydian.
Thanks, Rowan. And then it's the DHW 0263 and 0320. So these are both, they'll be really familiar to committee members, the IG risks. So if it's okay with you, Chair, I'll just hand over to Darren, who can give a good update on these two. Diolch yn fawr.
Afternoon all. Darren Lloyd, Associate Director for Information Governance and Patient Safety. Yeah, as Laura said, they are long-standing corporate risks, have been for a number of years, and talk about, in broad terms, the risks associated with recognising digital health and care Wales statutory functions, and the other one recognising the need for citizen and stakeholder trust in the use of health and social care data. There are many dependencies on government in order to assist in these mitigating these risks. As individuals will know, we've had a number of deep dives actually through this committee and through various forums within the HCW to try and look at what the mitigating elements may be and what the solutions could be. I think it is fair to say at the moment that in terms of those functional elements and the legal basis for supporting the use of data, is probably elevated into government and into a number of different areas quite starkly at the moment because of the dependency on other core programs. National Data Repository being one very large core program. Some of our own established business as usual functions as well through Rachel and Martin's team in terms of us doing the day-to-day elements of collecting and processing data. So we are still escalating the matters as they line up to all of those program elements. I think there is some, I think the word to use, I think there is some confusion within the system a little bit around those statutory responsibilities of those organisations. It's not just confined to DHCW, it's confined to other administrative services as well. But DHCW, of course, have got a large chunk of the responsibility for making sure the data gets from A to B, and under all of those type of directives that it has. The other element, which is the citizen and stakeholder trust, of course, is very important. There's been some recent work as well, and it is in the main body of the IG report around the statement of intent. So the statement of intent being a document that Welsh Government put together first back in 2017, which I'll describe a little bit more in the IG report. But within that statement of intent, the first guiding principle is about transparency and trust on use of information. So they are linked together. There is There is some imperative again in Welsh Government in order to refresh that statement of intent, but then what needs to follow on from that is the intent in actually how that's described and how that actually operates within the service, and of course doing that that important thing, which is engaging with public and engaging in that transparency element and that kind of that trust element. So there is some movement within government in order to refresh these parts. We are still very keen to support Welsh Government on trying to come up with a solution so that both our functions and the transparency elements move forward, certainly with some priority at the highest level.
That's very helpful, Darren. And obviously, if anyone wants to go and find out more about sort of how these matters are kind of assessed, the Information Commissioner's Office is the ultimate place where these matters are recorded. I think that the challenge is, and it's reassuring, in any governance environment, that DHCW cannot place upon itself permissions to use data. That we can't self-appoint ourselves in any role. So that has to be done by government, who has given us certain statutory responsibilities in liaising with ICO. And obviously we're very supportive of working with government and all of the stakeholders across Wales. But we just need to get those interests made more explicit and joined up. And I know you've been working incredibly hard on that. And I think the other thing just to highlight is, just for the record, I'll say, sort of in my day job, I have a lot of conversations with health organisations and organisations who hold data for research. And information governance is always front of mind in those conversations. In the conversations I've had with DHCW in this role, I would just highlight that Darren and his team are some of the most knowledgeable, experienced, and thoughtful professionals I've come across. So, Darren, I just want to say that just to reflect those in the minutes. And I think your leadership on WASPI in particular, and we'll talk maybe about WASPI in the IG report, shows how seriously we take privacy and assuring people's privacy in the handling of information, as it may need to move across the public services in Wales. So, Darren, I'm going to thank you for all your hard work, both as our subject matter expert, but also in working through these particular issues at the moment. So thank you for that, Darren.
Thanks, Chair.
Laura, are there any other? Let's just finish through the risks. There's quite a few of them.
Yeah, no, that's it for the public risks, Rowan. So happy to take any questions and open it up for discussion, and then we'll cover the private ones a bit later. Diolch.
Thank you, Laura. So David, can I ask you to start, and then Alistair, we can follow. Yeah.
Thank you. Yep. Thank you, Rowan. Thanks, Laura. I don't have any questions. I just wanted to make two observations. So, firstly, about the state of play on Canisc. We're coming up to our 4th anniversary as a SHA board, and we've been carrying this risk, which has been quite high since we were established, and it probably predates that by quite a bit. Rydian's got the detail if he wants to share it. I'd just like to say it's great to see that we're finally within touching point of actually being able to get off the old legacy system, and it be no longer a risk for this committee. It would be really nice if it just spills over into Q1 that it's been cleared before we have the next DGNS meeting. So just like to pass on my thanks to the team for all the hard work that's been put into this over the last 4 and a bit years that we've been around to de-risk this and have our cancer services in a much safer place. And the second thing I wanted to highlight was the update on the IMPS, which I appreciate. Thank you, Laura. but I just wanted to highlight, because we've had several briefings on this as a board, the good work that Sam Hall and the team have done to respond to this risk, and the plans that they've put in place, which covers us for whatever happens with the acquisition potentially of IMPS, or if it doesn't, we've got plans for that as well. So I just wanted to pass on my personal appreciation to the team for the hard work that's been done in that space.
Thank you, David. Very helpful. Alistair?
Yes, thank you, Chair. And just a couple of questions, really. On the new risk, which is the 0340. Thank you, Laura, for explaining. I should say I'm Alistair Neil, independent member. Yeah, the change and introduction of this risk. I'm just trying to understand, Laura, how that might relate to the GP services around the app and the links for residents through the app to GPs, if it does directly link. The concern being that if there is a delay or if there is a functional issue there, I'm certainly aware that in the area that I'm familiar with, I've done a sort of tour of the GP surgeries, and they're certainly promoting the use of the app, but they're experiencing some difficulties in the use of it. And I just wonder if there's anything you might be able to say about that. The other question concerns the removal of the risk 0338, which of course relates to connecting care funding. And by the withdrawal of the local authority funding in decommissioning the regional teams, as the removal of the risk spells out, this will have a direct impact on shared care records. And I just wonder, does this create a new risk as opposed to the removal of an existing one without the supplementing of an additional one, which might actually be a more problematic one than the original risk itself? And just your comments on that, Laura. It may be that it's no longer, as it were, our risk as DHCW, it's for others, but with the direct impact on shared care records, I wonder at a future stage whether that in fact would be something that would come back to DHCW and the concern around that. I appreciate your thoughts on that. Thank you.
So Alistair, those are two very challenging questions. I can see Rydian's got his hand up. Rydian, did you have a comment or an answer to either of those questions, or are you?
Yeah, so the IMPS, in answer to the IMPS, the two things that have been brought out in that question, Alistair, are not connected. The functionality delivered by for a patient through the app is a decision of the local practice. So that tells you if you haven't got the functionality in your app, that's because of a local decision not to switch it on. Obviously a GP surgery couldn't switch it on if they didn't have a system. That's the other part of the question. And Laura highlighted the fact that we've got a reducing number, currently below 150, and that will reduce over time.
I think, Alistair, the other matter that you raised around local government funding, I'll let Laura, if you've got a comment, obviously, do you want to respond? I think the other challenge is, where does that risk lie? And it's a bigger governance question across the wider public service system. So Laura, I don't know if you've got any thoughts about that, or whether the exec management team have discussed that within the
business. I think we have discussed it, and we discussed it a bit at audit committee as well in terms of when we downgraded this risk. So it is a question of, it's not DHCW's risk, but it is a risk. So where does that sit? But we are doing work at the moment with the executive team around horizon scanning. So what does that mean for connecting care in the programme going forward? That will be something that we're discussing as an executive team. So we might then see new risks come in relation to that, because that one's been removed. So, so I suppose whilst it's not directly our risk, we might have other risks in relation to connecting care, but not specifically the funding. Alistair, I think that is one that's not the HCWs, but it's a wider system thing. Is that helpful?
Yes, thanks, Laura. I fully appreciate that. I suppose my question related in significant part to the shared care records. If at a future stage funding were to come through connecting care funding, so it's one of the risks that we're taking out, the 0338. So for example, if next year or the year after that we were to actually see the funding coming into place for which we had an accountability, if there is a reduced and any significant reduction in the development of the shared care record, then that could well be something that does have an impact on us in a following year. So just highlighting that as a concern, but I completely can see that we cannot bear every risk that sits across the public sector. It's simply that it has been in our risk profile. We're removing it, and it's just that question around actually have we still got sort of one leg in the in that particular risk down the line. So thank you.
Thank you for highlighting, Alistair. The shared care record is obviously really important. Part of the infrastructure that we would hope to be able to deliver services across. David, one more comment or question?
Yes, sorry if I may come back in, Rowan. I did mean to ask about digital eye care, which has been removed. Is there a summary that you can give us, Laura? My understanding was we were waiting on additional funding. Has basically the programme been put into a situation where it's on hold as opposed to a risk that we're carrying?
Yeah. Thanks, David. So it is currently paused, the programme, whilst we work through some of the negotiations on, what the national options are for moving the programme forward. So the existing risk has been removed, and then we're just doing an options on what it looks like going forward, that might bring some more risks as well.
Right, okay, but I understand. Thank you for the clarification.
Any more questions or comments on the corporate risk register for public? Thank you for that, Laura. Very ably handled, so thank you very much for that. And I'm now going to move into the assurance part of the agenda. A request was made at the last meeting to update to include the learnings from the NHS Wales app. Now we've got a reasonable amount of public beta testing experience under our belt. Keith, Keith Reeves, I'd like to welcome you to lead us off on the service, this particular section of the agenda. So the review and learning report, please.
Thanks very much, Chair. So I'm Keith Reeves. I'm one of the service management team managers within DHCW. I've asked Matt Cornish to also join. So Matt's Programme Director for the Digital Services for Patient and the Public. If I run through the Q3 report, take any questions, and then we can hand over to Matt to pick up the NHS Wales app specific elements. Matt's got more of an idea of what's happening within the app, so I'm sure that there'll be a lot of questions that you'll probably want to ask him as well. So generally for the Q3 report, the same format that I've done as we do every quarter. The report itself has been issued with papers. So some of the brief highlights under the reporting section, and we've talked about it earlier with regards to INPS. So we've had one early warning notification issued in Q3, and that was in relation to INPS. Wider, there's been 16 complaints or formal complaints, concerns, feedback received. 14 of those were in relation to the NHS Wales app surrounding some of the functionality. And as I said, Matt will probably cover off some of that as we go through. Under the reviewing, I think there's a common theme that we're averaging about 3 reviews in the meeting per month. But what we're noticing now is that what we're trying to bring in now is a lot more variety in the reviews. So whilst there are a number of technical major incidents, we've started to include some of the wider areas. So there's elements around responses to the DHCW staff survey. We've had presentations around artificial intelligence. We've had presentations around the lessons learned for the app, and also a couple of thematic reviews. So I think for Q3, it's been quite useful. It's been quite a good few meetings with a lot of conversation, a lot of debate, and a lot of just the general sharing of the lessons. So in total, we've had 28 reports so far across the reporting year, and we've still got two more meetings to come. So there's going to be a lot more variety coming through that. On the learning front, within the papers, we've included about the app itself, but we've also done a thematic review for major incidents surrounding the Welsh Nursing Care Record Service. And one of the service management teams has done an absolutely brilliant report on this, covering the sort of 60 priority 2 incidents that we've had over the reporting period. So the reporting period was just over 6 months. And whilst 60 major incidents may sound like a lot over that time, a lot of them were in relation to general themes. So as part of that thematic review, we're looking at the patterns for failure of the systems. It also allows us to then plan sort of against any potential future outages. It's also looking at the common themes. So some of the findings that we've looked at are actually around inefficiencies in working practices. And that's in relation to how the support teams sort of manage and undertake problem management, how we respond to some of those incidents, and also how we look at capacity management. So there's been a number of recommendations, number of follow-up actions that are currently underway with regards to the efficiency working. The likelihood is that there will be more improvements coming in the next financial year in relation to actually making some of our processes much more efficient, and that will be part of the service management function going forward. The contributory factors framework, I think again it's a common theme that I've been covering off across a number of the meetings. So we're still having a number of active failures, the departmental failures, which is those involving the direct sort of application or infrastructure related issues, and the external related issues. So this could be something caused by the supplier, or it could be something that's actually happened outside in the health board, but it's affected one or more of our national systems because of the nature of where they're being hosted. Primarily, this is around the radiology service, where there's a lot of local hosting, and there's programs of work in there around sort of centralizing or providing either a centralized service or providing a third-party service in replacement of that. And then the last section, which is around the improvements, I think it's fair to say that again we've been very, very busy so far across all 3 quarters. We have completed yet another improvement. So we talked earlier about the risk around the service portfolio. Service management team have undertaken an improvement to review the service portfolio. They set themselves the target of having quality of data within that portfolio of around 85% by the end of the financial year. In December, they hit 86%. So whilst the improvement has been completed by hitting that target, we're continuing to monitor that just to make sure that we've got it sustained. And there's elements in there that we know that we've got further information coming from the information governance team. So I know that Darren's team have been very, very busy with this. So probably in the Q4 report, we will come back and we will show the evidence of the sustainability. And moving into next year, we'll then continue to monitor it just to sort of make it almost like a performance indicator for the portfolio and for the catalogue to ensure that quality of data, because that the benefits that we're seeing from this already are starting to come to the forefront. That's that on the main report. So before I bring in Matt, are there any questions?
They look like there are, Keith, and just compliments on the report. So the Appendix A that I've got in front of me, really nice, clear report. So thank you for that. Laura, you have your hand up.
Yeah, Chair, and thanks, Keith. Great report. I just wanted to clarify just for and explain for committee members. So in the cover report, you'll see in 4.6, it says there's been a reduction in inquiries from 246 in Q1, and it's reduced quite significantly in Q2 and Q3. So I just wanted to explain the reason for that. So in Q1, when we were having a higher number, it was because the corporate governance team had responsibility for all inquiries, concerns, complaints and feedback. And because of the higher numbers, they were relating to the NHS Wales app. After Q1, we put in a new support model for the app. So anything then relating to the app was routed through to the service desk and dealt with there. So it's just for members to be aware that of those figures in Q2 onwards, they don't include any concerns, complaints and inquiries in relation to the NHS Wales app. These are general other ones. So I just wanted people to be aware of that and not think that we suddenly didn't have any, because we do. They're just routed through a different way.
Thank you, Laura. Alistair.
Well, that's very helpful. That's knocked out one of my questions, Laura. So thank you. That's very straightforward explanation. My other question was this, and Keith, thank you for the report. Very good indeed, and reassuring to see the really strong focus we've got on learning and improvement, which can only be helpful to us as an organisation. But actually, it's the sort of work that goes on, in many cases unheralded, but it really is such an important aspect of how we're going to move forward and keep moving forward as an organisation. So thank you for all that hard work that goes into it and the team around it. My question is this: that the learning is tremendous, and the focus that then leads to improvement, is greatly to be welcomed. Prevention would be obviously the preference for everything that we do, and I'm sure you'd feel the same way if we were capable of preventing incidents rather than learning in the first place. I wonder to what extent an organisation such as ours is able to look outside of our own organisation to assist in that, in prevention, so incidents are prevented rather than they occur and we learn from them. And I just wondered if you had any comments on that, Keith.
Sam, do you want to come in first, and then I'll add anything else, because I think we're probably having the same thoughts.
Yeah, thanks, Keith, and thanks, Alistair, for the question. I'm Sam Lloyd, Exec Director of Operations. I think the point about prevention is really important, isn't it? And that's really, I think, what is behind a lot of the more strategic activity that we're undertaking as an organisation at the moment. So things like the shift to a more modern product-centric operating model, the move to a cloud-based hosting, starting to look at mechanisms for improved monitoring and automation of systems. Those things are all kind of really in the strategic prevention space around increasing the reliability of systems and services and moving to a modern operating model that enables us to, to build and run and test all as part of the same process, so that we should be reducing our exposure to incidents. And so, I think that is really at the heart of the more strategic activity that we're starting to pursue now.
And I'll just add, Alistair, that the one thing we always want to prevent is anything on the cyber front. And I think there's been some good, learning from wider systems and other unpleasant events that thankfully, she said, touching wood, have not occurred in Wales, and we hope to keep it that way. But I think it's a really good challenge, Alistair.
Yeah, I think the other side of it is again, it's going back to that, looking at the efficiency of the processes. So if we're identifying that there's sort of that human error element, and that's why we have the contributory factors in place. So if we've got a human error element around, say, poor change management, we can then look at, okay, how can we improve that? How can we improve and ensure that the proactive work that we do through change is managed in such a way that we're able to assure it, and we're able to ensure that those changes are successful, and reducing the number of errors. And I think it's one of those things where we have to look outside in other areas of industry where they're implementing things in an agile way, but they've still got to have those the sort of safety thresholds that we have to have. And I think that's going to be the sort of delicate balancing act that we're going to have to think about going forward.
So thank you for that, Keith, and Matt, you're not here just to make up numbers. I'm very pleased that you've come along, and we did ask for some of the learning experiences on the early phase of development. I just remind everyone the app isn't officially launched yet. I think we're still in public beta, Matt, if that's correct. And of course, that's when you expect to encounter some of these issues. So Matt and Keith, there's a couple of slides that deal directly with the app in the committee pack. Matt and Keith, do you just want to kind of give us a sense of some of the challenges of the public beta? I think in some respects, I'm always encouraged when there's a lot of engagement from prospective users in this phase of product. It just tells you that people care about it. Here I'd like to hear from both of you really. What have been the common themes that you've encountered, and what have we learned through almost our first direct engagement with the public, if you like, as DHCW?
Mind if I start, Keith? Is that all right?
Yeah. If you start.
Okay, that's really helpful. Thank you, Chair. Well, you mentioned it's a short phase. So it started on the 17th of April 2023. So not that long ago, relatively. And in that phase, or in that first year, we had the task of adopting all 373, slightly more than that actually at that time, GP practices to the NHS Wales app. And we had the challenge of working with both system suppliers, different stage of readiness. We started off with Cegedim because EMIS weren't ready. And then we moved to EMIS because we needed a more aggressive adoption of practices because of a kind of planned outage of My Health Online, and then moved back to Cegedim. So, a few challenges within there. And we kind of grew the number of users of the NHS Wales app, and those users provided really valuable feedback to it. So it's a continuation of what we did in private beta, in that we had the same feedback mechanism, and we were picking up at that time when we first started the kind of improvement feedback, what you want into the app into the future, as well as issue feedback. And it took us a lot of, in a sense, mandrolic effort to be able to separate those out. And over time, what we've done is we've streamlined that process, we've automated that process, so that those two types of feedback are separated. And so when someone's got an issue with the NHS Wales app, whether it's a technical issue, we're able to get far more valuable data, a kind of a minimum data set, which allows us to investigate. And we found through this process that alone isn't often enough. There is a need to be to engage with patients and the public who've made that particular issue known, so that we can, find out some more. Sometimes we can ask them to do some various changes. And so we've established and bolstered our service desk to be able to carry out that patient-facing support function, but behind a layer. And that also has helped us in terms of the actions we want from practices, because some of the issues which we have, aren't just a simple issue. There you go, we pick it up, we ask somebody to do something and it's fixed. Because of the nature of the EMIS and the vision systems, there's configurable actions which we need the practice to do. Through our learning, we've streamlined what we ask of practices, so there's more we can do from logs ourselves before we ask practices to do something. And that's important to us, and clearly it's important to them and to GPC Wales, because they're very acutely aware of extra demands in supporting a new product, a new service. And we were able to explain to GPC Wales late last year actually the process, what we do, how we do it, and how we minimise demand on their members, which satisfied key partners. The last thing which I'd kind of mention, we're now at just over 330,000 people who've adopted the NHS Wales app. And that's been achieved largely with GP practice focused promotion. As you mentioned, we're not at the public campaign yet. We're expecting to increase usage far further. There's also around 110,000 repeat prescriptions carried out via the NHS Wales app each month, which equates to the kind of peak number of transactions from My Health Online previously. So we've already kind of captured that important market, but we needed to replace. And the last thing which I'll kind of mention is the type of issues we receive from that feedback. Now, there are kind of technical issues which we need to be to work with system suppliers to resolve often. And so that's working with EMIS on particular problem records, which we capture. There are also kind of issues which sit kind of slightly outside the app or alongside the app. And these are things like the absence of an alternative means of being able to prove your identity to get on. We've talked about the Welsh Identity Verification Service, and I'm really pleased to report that we've worked collaboratively with government and GPC Wales. It's been included in the GP contract to support that capability. And we're just about to take a plan to the implementation group about how we're going to deploy that capability across all GP practices in Wales, which will meet a great number of people who want to get on board. And so we hope to have that agreed, hopefully deployed by early summer. So that would take out a big bucket of kind of feedback which we get. Another big bucket of feedback we get concerns the absence of proxy access to manage the care of a loved one, or a child within the same GP practice.
Hopefully they're loved as well.
They are loved. I know. I realised I was going down the wrong avenue there, but don't worry. But you know what I mean.
Yes.
We've got that feature. We need to be to prove it with a Pathfinder practice. We've got a number of Pathfinder practices who want to work with us, and then we want to be to share that learning with other practices and allow them to be able to take up that feature, which will be important to us as well. And that will be a means of being able to responding to a gap which we see at the moment. And then the last area of feedback which we get, and sometimes it relates to others, is about digital inclusion. It's not always easy for people to take advantage of digital services. And there's an extent to which we can provide the resources which support them or loved ones to support them. But there are wider issues at play, clearly about data poverty, access to resources to be able to do it. And so, from that regard, we always try to use the leverage we have with government to be able to try to do more and exercise their leadership. So kind of that's the reflection so far. We've kind of bolstered where needed. We've always we've looked critically at what we do and sought to improve. And I think even Laura described that in terms of some of the challenges we have, because people will always try to access us as DHCW in different ways, not always through the channel which we want them to. And it's important that if it is an issue, it gets to the right channel and then can be reviewed and assessed in the right way. Yeah, probably that's what I want to say.
Thank you, Matt. Now, has anyone got any specific questions for Matt? David.
Thanks, Ryan. Thanks, Matt, for the update. We had a bit of a surge when we went into public beta. Next phase would be for public thing, and would expect another surge of new users coming on. Can you just sort of talk about what improvements we've put in place off the back of the phase we've just gone through in order to better deal with another surge when that happens? And if you've got a date for when that's going to happen, it'd be useful if you could share it. But I suspect that might still be in discussion with Welsh Government.
Well, officially, we're on a hold from Welsh Government in terms of planning for and announcing the public campaign. The reason being was because of the absence of a clear pathway on the WIVS journey, and from a programme perspective, we didn't have confirmation from government on our funding settlement, and so we wouldn't be advertising a public campaign without knowing how much we've got to be able to deliver it, and I kind of know that's well understood. In terms of our service desk, we're always keen to be the right size against demand, and what you'll have seen from the slide pack presented is that our demand is fairly stable despite the increasing number of people. We have a finite number of issues which we investigate and resolve, and so we don't have an expansion of that. So we're in a pretty good place in terms of the level of understanding that's given to us. We expect, of course, new users will want new features and new functionality. We've only just integrated with the Swansea Bay patient portal. That's our first proper integration, and we have 11 users in the Swansea Bay area working with us. Of course, once we've done that, it's working exactly as intended, then there's the rollout to many more users within the Swansea Bay area who use their portal, and so we'll see a further upsurge in numbers. That may give us some more learning, but we're expecting kind of iterative improvements over time. We have had, and I didn't mention this before, the public beta phase has also given us the experience of when things go wrong, right? And I'll give you 3. We've had a failed change from EMIS, which has an impact on the NHS Wales app. We've had an NHS login failed change on a Friday afternoon, which caused an impact on the NHS Wales app. And we also had a national Microsoft CrowdStrike kind of issue, which affected everybody, I think you remember. What we were able to do was to be able to put on the front of our effectively Qualtrics mechanism, our feedback mechanism, the acknowledgement that we knew there was an issue, we were resolving it so we could manage expectations. And what that led to was, not everybody who uses the NHS Wales app then putting feedback saying, I think you've got an issue here. We were able to quickly resolve, and then we were able to put an updated message on. So we have got a means of being able to manage demand even when the unexpected happens. And for a great extent, the app has been designed so that it fails safe. So that, if a particular module goes down, then we can manage that. People can use other functionality within. So we are confident about where we are. We are looking, if I'm being really honest, about the public campaign, although, it's not official, we'll be looking towards September, assuming that we've deployed WIV successfully, assuming that the features which we've got in train, take up well, then that's to be the date we'd be advocating for, because it's kind of ahead of winter, and so that any effect is likely to not cause impact for other service health and care users. So that's kind of a description of where we are.
Thank you, Matt. And it's a great conversation. I'm watching time, but a couple of quick questions or comments. Alistair, please.
Yeah, thank you, and thank you, Matt. Very interesting indeed to hear what you've been saying on that. And I think September would for all sorts of reasons be a good timing. I just wanted to very quickly do a sort of sense check with you that we're obviously not the first country in the world to introduce an app. Therefore, we're not inventing a wheel. How much are we putting into learning from elsewhere so that we can get this, right all the time as soon as we really go live and start, when we start publicizing it?
We are, and so we did. Well, for a long time, we've had a really active dialogue with our colleagues in England. They've took a different path in a way, in that, when they launched their app and they promoted it widely, particularly with the upsurge in usage as a result of the COVID pass, they put in place a public-facing desk from the outset. And the challenge which we wanted to avoid, and why our service model doesn't do this, is we didn't want effectively another service-facing desk for the NHS to be to answer kind of all kind of maybe ills of the NHS, or there to be any possibility of confusion about, you know, maybe Meridian would support me, people kind of approaching that desk and looking to get a clinical opinion on something. You know, we wanted to be very specific that our desk is there for kind of technical resolution of issues, and ahead of the desk, you know, we've got curated guidance which helps people to be able to understand actually what they should be seeing and be able to provide the right information through to us. So actually, by dint of, I think, relative success so far, you know, the number of people approaching us and registering issues is fairly static. He says it's not growing as the usage base grows, and that we've got a good understanding of the issues. But you know, we'll always remain mindful of demand and making sure that we've got our desk appropriately configured to be able to support it. And the last thing I'd say is, you know, while we're looking to solutions, we are looking at what AI could provide us into the future. And I know that some people have different prejudices about AI. They, you know, want to communicate with a bot, but we want to see whether that will help us in terms of streamlining some of our processes and allowing us to use person resource where it's most appropriate.
Thank you, Matt. So I think that was a really good discussion. Now, I've been bad chairing that and we've run over, but we were due to have a quick comfort break. So if I ask us to come back at 2:05, and then we'll pick up with the Information Governance Assurance Report. So thank you both, Keith and Matt, for that contribution. Very valuable. Thank you very much, everyone, for coming back promptly. We're going to move on to the Information Governance Assurance Report. This was partly requested during the last meeting that we get an update on progress with WASPI and the response from the Information Commissioner's Office, or ICO. And I think there's some other matters that we might touch upon, Darren, but can I go over to you to lead off the discussion, please, and take us through your report?
Certainly, thank you, Chair. Yes, so the report is the standard report that you receive on a quarterly basis. There are some highlights in this, so I'll just go over a couple of them. The report covers off the usual elements of our performance, etc., etc. But in terms of some of the relevant updates, part of the alignment within the information governance strategy, of course, we wrote the strategy a couple of years ago. It runs up until 2006. We are ensuring that we are keeping closely aligned with that strategy and the promises we made within that. We in broad terms, we talk about an information governance framework and all the pillars that actually result in that framework, and our inward and our outward responsibilities for good governance, for good information governance and safe sharing of information effectively. So that program of work continues, and we move on at a pace in some of those areas as well. So it's really good that we're keeping aligned to the strategy, always making sure that we test ourselves against it. One of those elements is around assurance and quality. We have something called the British Standard 10008. That has been an ongoing quality assessment around legal admissibility and the weight and evidential weight of electronic information, stored information. As the committee are acutely aware, we hold large repositories of patient information, circa 60 million K records, 320 million test results, and other K record repositories as well. So it allows us to set against the management of those K repositories and those repositories of data to show that we have good management functions around them, and that the quality and the admissibility of that information contained therein builds across a standard. So we've maintained that standard for a couple of years. We've had a number of audits. We've just recently gone through an audit and then gained reaccreditation. We have another end point in 2005, which gives us a more larger recertification of that audit, with a potential opportunity to understand whether we want to vary the scope of what we're currently assessing against, and whether we can increase the scope dependent on where we are with increasing our volumes of data that we hold as national repositories. And of course, we are increasing other areas of collections of electronic data. So it's a very important standard from our perspective, and something that we actually hold as part of our strategy. There are other elements as well where there's learning to be done. Learning internally in terms of our own corporate responsibilities, so making sure that our own employees understand their data and their information responsibilities, managing of in likely events of breaches and events of around incidents, and doing that learning. And we spoke about that earlier with Keith around some of those learning events, those type of things. So it's making sure that we are visible within inside the organisation and individuals continually understand their data and their information responsibilities. There's also aspects of understanding where we are supporting learning mechanisms outwardly with the framework. So we have something called the National Intelligent Information Auditing System, and more recently we've done the rounds to make sure users of our NIAS system are acutely aware of their responsibilities for monitoring their staff against those core products and those services. And indeed, not in the report, we have a revision of our contract in 2026, which means that we are currently looking at what we do with NIAS strategically over the next couple of years, but building into working with our commercial and our procurement partners to build into the next iteration of NIAS as well, and increasing the learning around what is a core product for us in terms of that privacy agenda. Some of the aspects as well in terms of the toolkit, our own submission, our own assurance by making sure that as an organisation we comply with information governance requirements and the toolkit. So we both build the toolkit but also assure ourselves against the toolkit as well. So as you'll see within the report, last year's audit and our improvements made, this is about moving forward now for the next one and measuring ourselves against the same level of similar level of compliance, but understanding where we might have to make or we can make improvements again through some of that learning. So that's kind of a very quick whistle stop around some of those highlights. The one thing to spotlight and was taken up in terms of the actions was the Wales Accord for Sharing Personal Information, or WASPI for short. So it is coming into a 20-year anniversary of the Wales Accord for Sharing Personal Information, a very, very big birthday from our perspective. The story of WASPI has continued over that 20 years. It started with very small seeds, let's just say, and very, very small beginnings, but has developed in capacity and its reach and its depth. As you may be aware, that the Information Commissioner's Office have started to establish codes of conduct. This means that it sets greater obligations on organisations that want to sign up to these codes. So what it means is it doesn't, as WASPI is at the moment, is voluntary, and there are no measurements necessarily around compliance for those organisations set against who are happy to sign up to it. If organisations sign up to a code, it means there are more obligations on those organisations to comply with the framework that's contained within those within that particular discipline. It's very good from our perspective because it allows us to measure aspects of how WASPI is used, or whether there's improvements can be made organisationally, both from ourselves who are delivering it and those that are using it as well, in order to continue the good work of that. I've previously, and I think Dave mentioned Dave Parsons mentioned in the previous meeting around where its largest sort of impact has been, and that its seeds and in the early germination of WASPI came out of child and adult protection. And so that's still the case. So we are linking with local authorities, the 22 local authorities, and with the health boards and a lot of public services to understand how that adult and child protection has grown, and how WASPI is a framework to encourage information sharing and to make sure that that information sharing is done within the law, actually has a better penetration within inside those services. We've talked about previously about how new initiatives for sharing, where Wales Accord for Sharing Personal Information should be actually alongside those new initiatives to make sure that the same framework's being used all the time, so that we're not trying to, for want of a better word, reinvent the wheel. Organisations are not reinventing the wheel, they actually understand we've got the tooling for them to use. That said, we see on a daily basis of failures where information has not been shared. Information has not been shared, and unfortunately there's been some very adverse outcomes around child or adult protection. They continually to be in the news. Now, WASPI is not one solution. There are multiple factors in all of these things, so please don't get me wrong in terms of WASPI is not just one solution to that. But this does help in terms of trying to assure organisations that there are right ways and there are incorrect ways of actually sharing data when it is absolutely clear and a requirement to share data where there's a need to protect certain individuals and certain functions and services. So WASPI's 20 years coming up. We do want to celebrate that because the story of WASPI has continued. There's been continued support for that. The code of confidentiality, we're hoping to get that over the line really quickly. We've had recent conversations with the ICO. They are now keen to support that, getting that over the line. We are hopefully going to submit the code for formal approval in the spring, this spring. So that means it will go through a 12-week consultation process with the Information Commissioners, having a much wider, much formal view of what we're hoping to achieve by that code, the impact on the service and public services, and then the impact on us as an organisation in order to support the actual obligations of the code from an audit perspective. We are lined up from a resource perspective. We've had very good support from DHCW as an organisation from a finance perspective and from Welsh Government in terms of policy areas actually coming into line with this. So we are set to actually almost push the button on actually getting this code up and running. And like I say, more recent conversations with the Information Commissioner's Office where they're ready as well. We hoped to be the first code of conduct. Something's just snuck under the line with the ICO on something slightly less intrusive, let's just say. But we're still hoping to be the first code of conduct. So we're hoping, as I say, we're hoping to actually go through that formal consultation process in the next couple of weeks. The only other thing to say, I suppose, in terms of WASPI is we still continue with the WASPI story. We don't stop just because of the code. It still has a lot of ambition in terms of its current phasing, and we're still retemplating things and making a lot of improvements on the current phasing of the Wales Accord for Sharing Personal Information, and we're still getting a lot of response, and we're still ensuring that the assurance mechanisms within WASPI still continue within this current phase. That's all I kind of wanted to say, I suppose, Chair. The other element, I suppose, was the DPIAs. We continue to do the privacy element within the report. You will see there's a lot of data protection impact assessments being created, and we talked about. Rydian gave an update in terms of CANISC. We've talked about other large programs of work as well. If you look at that, you will see that the actual activity within the organisation follows what we do in terms of that privacy but design through our data protection impact assessments as well. So that list is a real good indication of the amount of activity that's actually going on with your organisation and the amount that we support through all of that programme work as well. So I'm very proud of the fact that we really do follow on that privacy by design commitment with our programme, with our programs that we're ultimately responsible for the delivery and implementation. I shall stop there and allow individuals to ask any questions.
That was a fantastic summary, Darren. And, Rydian mentioned in CANIS the palliative care. Quite a lot of palliative care is not delivered within the NHS. It's delivered through other organisations. So there's a very clear example there where maybe WASPI might be involved. Not always, but maybe. Alistair and then David, some questions for Darren, please.
Yes, Darren, thank you. Thanks very much indeed. Very informative and very reassuring too in so many ways that you've explained. It's really because it is so important and because the direction of travel of shared data in the greater care and health of the people of Wales has so much potential that this whole area I imagine is simply going to become only more and more and more important. And right at the heart of it will be the trust and the confidence that individual members of the public has in the use of the shared data and the potential benefits of it. So it's really in that space that I think this is so important. But my question really is therefore, first of all, are we talking about the managing information beyond patients, are we not managing information of people who sometimes become patients? And I think if that is the case, I think we've got to be careful not to use the word patients when we mean the public. Within the NHS, I think that's something we quite often drop into. But I do think that this has got, the public members of the public, that takes us into the domain of prevention. It takes us into the domain of care outside of primary care, etc. So it's very, I think it's more than just a word. It's got so much tied into it. But the more important question, Darren, is to what extent are we actually engaging with the public around the way in which data is shared and how they feel about that and how they see that, to help inform us in the sort of work that we need to do to ensure that we gain their confidence and trust, and continue to do so. So a bit of a preamble, but that was the background to the question. Thank you.
Thanks, Alistair. I think it comes back to what we spoke about in terms of those risks, that risk around transparency and trust. I would like the opportunity to actually promote what we do to the public, because I don't think I think from a Wales perspective, we do enough of that. WASPI is one facet of that in terms of trying to assure them that we have tooling to allow those things to happen safely and securely, and but also in the benefit of the public. Those individuals, those people that are resident within Wales. So I'd like the opportunity to shout quite loudly about those things that we have, because sometimes the lack of communication is sometimes then seeds doubt. So if we are transparent about those things in terms of those frameworks we have, we are very upfront about the fact that, yes, we have thought about these. We do have mechanisms in order to support the public through the needs of the public, whether that be through a patient lens or any other lens for that matter. So it's really important that we do that. I think this is about engaging government and engaging the fact that, yes, we can provide a very positive narrative. There will always be exceptions to that. But I don't think we should be afraid of that. We should be trying to promote the very good things that we already have in place. And I think that's about making sure that we take government along with us, give them the confidence in order to provide that narrative out to the public. We do that individually through some of the programs and work that we do as well, and we're responsible to DHCW. Matt was just on about DSPP. That is a front door to us. We have other front doors into the public as well through the other program work that we do. So we do those individually, but not necessarily strategically at the top level. And that's the element of where that, in some respects, the risk comes from, that overall corporate risk, is having that strategic approach of actually telling the public of all of those good things that we're actually doing. And that's kind of my answer and my interpretation of that.
And making it a formal code as opposed to a voluntary one would mean there'd be auditing and more places where you could actually reassure yourself that the appropriate scrutiny was there and people
Yes.
were doing, we're adhering to the code fully, Darren. So I think that's a great point. Yeah. David.
Thanks, Ryan. Thanks, Darren. Darren, in the report, you mentioned that we strengthened the existing WASPI framework with some templates, and you talk about joint data controller and data processor. Can you just expand a little bit around what those terms actually mean for us?
Really good question, David. So within the law, there is a need for some level of roles and responsibilities to be defined, and those responsibilities are like I say, they kind of come into the law, the General Data Protection Regulations as prerequisites. So if you have two organisations who have a responsibility for data, then it is very clear you have to have some level of clarity on how those roles and responsibilities are set. Sometimes they come in contractually, so they're part of a contractual arrangement, but where you haven't got a formal contract with a third party or commercial third party, sometimes you have to put those as a provision outside of those formal arrangements. So a data controller agreement or a data processing agreement kind of just sets out the obligations of those various organizations and whether they are there to process the data on behalf of somebody else, or have some kind of controlling function on either the collection, the processing, or the disclosure of the information. So those agreements just trying to set that. So again, there's clarity and there's transparency on each individual organisation or in each individual entity's role and responsibility as part of that information sharing relationship effectively.
Okay, thanks, Darren. If I may be allowed a supplementary. So are there any data sets within the scope of WASPI where DHCW are actually the data controller for those data sets?
I think WASPI is we will come into some of those areas of work. As I said, there's a lot of child and adult protection elements of more general public service where they will not be, we won't necessarily have any touch points on the data, but we will have some touch points in the data where we'll have some control elements on them. So there will be aspects that come into, say, some of our programme work via WCCS, which is the Welsh Community Care Information System. We talked about Connecting for Care, Laura talked about Connecting for Care. So we will have some controller obligations from a data perspective where there is an engagement with other public service or organisations that have a responsibility for the public. Okay. Some of them we will be outside of that because there will be, for instance, there will be adult protection that come very much within the health board or the local authority space where we're not responsible for the data assets that come with that.
Thanks very much, Dan.
Thank you, Darren. And as you can see, information governance is not nearly as dry as it appears. It underpins everything we do. So thank you for that update. And we are running late. So I'm going to turn to Martin to provide the highlights of, I think, having been assured both with Keith and Darren's reports there comprehensively, both of you. So thank you for that. So we're now turning to our standard governance reports. Martin, I'm very pleased to welcome you. We've got two reports coming from you. Firstly, the Information Services Assurance Report. If you could take us through the highlights, because we are running a little behind now. So I apologise for being late.
No problem. Thanks. Yeah, no, thank you for your warm welcome to the meeting. So just so everyone knows, my name is Martin Williams. I'm a data manager, so I'm responsible for the overseeing the teams who look after the National Data Warehouse and the Analytics Programme. And I'm here today because I'm deputising for Rachel Powell, who's Associate Director of Information Intelligence and Research. So, like you say, Jay, I'll just take you through the highlights of first the Information Services Report. So in terms of the strategy, things are on track and we're making good progress into our second year. Everything is going well. So there's positive news there, and I think that's already been presented to Management Board. Equally, with the ISD Assurance Group, it's a group that meets within Information Services regularly, and we've received a number of quality plans through that. Also, all milestones within the IMTP were achieved as planned by the end of Q3, so positive news there. In terms of some more specific elements, there's been a new custom reports tool which has been designed, which has saving time for colleagues, and not just within information services, but it's been extended out to other areas within the clinical directorate, including Darren's area and Steph's area. So that's good sharing practice. The corporate Power BI team continues their good work, showing all the many dashboards that we're producing. So I think it's in the paper, but there's about 70, I think, that have been approved. So that's really positive. In terms of specific things that have been achieved recently, the ETR, which is the Electronic Test Request Pathology Phase 2 dashboard's been released. In terms of the data warehouse, we've got a new test environment which is powered down out of hours, which is saving us some money. So it's always good to hear that. In terms of specific dashboards, I should make a plug that we have a website which is on the main website. You can go in and have a look at all of our dashboards, but I'll just highlight a few that have been recently released. In terms of valuing health, we've got a number of dashboards which have come out recently. We've got cancer. We've talked about the CANIS replacement programme already today, and there's a number of dashboards that we've produced that are supporting in that area of work. Also, in terms of the switching service data set, there's been successful demonstration of that recently, and I think previously it's come up about service point calls, which I think a year or so ago weren't being dealt with appropriately, now are, and there's 100% closure rates. That's positive news. And organisational service improvement on the service portfolio. Details of all of those are in the papers that have come with the meeting. There are risks. I think we've talked about those already, particularly in terms of the GP services and sharing of information. But those details of those are within the notes. So that covers everything in terms of the information services report.
Well, thank you for that, very excellent summary, Martin. And I'm going to call out the Power BI. You guys are real power users. I love the IMTP automatic reporting that's going to be done using those tools. So we're benefiting ourselves from your expertise as well as the wider service. Laura, David first, and then Laura. Thank you.
Thanks, Warren. Thanks, Martin. I just wanted to say well done on securing a bit more time on the audit plus going out of service. That's going to help. I just wondered if you could sort of give me a feeling for our level of confidence around being able to replace it before that extension runs out.
I'm not sure myself. I don't know, Vivian, if you wanted to come in to talk and to pick up that point. If not, then I can go back and speak to Rachel when she's back from leave, and we can address that point.
Yeah, I think we better speak to Rachel.
Yeah, okay. So sorry, David, I'll pick that up with
Rachel. Okay, that's fine.
My area of focus is primarily on secondary care, so I don't know all the ins and outs in terms of the primary care work, but I'm happy to answer that and bring it back to you.
Okay, thanks, Martin.
I'm always impressed when someone says, I don't know, I'll go and check. So thank you, Martin, for that. That's great. Laura?
Thanks, Chair. Just a quick one, Martin, on the Director at Risk 0310. So this has been brought to the committee twice previously, and obviously we did downgrade the risk from a corporate level to a directorate. It's just to raise, just keeping a close eye on that one, because if we keep having repeat instances, we'll probably have to look at the scoring of that risk, and it might tip into the corporate level again. So just if you just work with us on looking at that.
Yeah, absolutely. Scoring. I think now what's happened that the assurance processes for dashboards is fully in place now. The work has been done to go over existing dashboards to make sure they were all fully assured, and there's a good process in place. I think one or two were picked up that had slipped through the net, but I think as of now all dashboards have been through that process, so I wouldn't be anticipating this to happen again. Certainly not in terms of dashboards, because we know which dashboards we have. They've all been dealt with appropriately. Obviously there's always a risk in the nature of our work that small mistakes can happen where data is released accidentally by either giving the wrong through natural human error. But in terms of the processes, all the processes are in place to really minimize that risk.
Gwych, diolch.
Yeah.
You've done an excellent job for Rachel on this. So let's see if we can be 2 for 2. If I can ask you, Martin, to also provide the Research and Innovation Committee report paper, please.
Yeah, absolutely. So this report's been put together by Sadaf Shaheen, who's the lead for this area, and I'll go through some of the highlights from this. So obviously the Research and Innovation area has been around since 2023 and is really getting properly established now, which is really good. As with the information services, all of the objectives are on track, and the strategy is being implemented. So all positive news around there, and things around the branding and marketing plan and communications and so on have also been developed. So in terms of the plan, things are working really well, and the team continue to meet with key stakeholders. In terms of specific matters for consideration, the progress is being made. towards research and innovation actions. There's a learning and development plan which is included within the papers, so do have a look at that. And in terms of the work through engagement that the R&I team are doing, they continue to meet with key stakeholders. We've got specific communications and engagement plan, and there's a number of events that that have been attended to try and promote the work that is going on, and to try and hopefully bring some more work in. Details of those again are included in the papers, so do have a look at those. And there's been a number of interesting projects which the team have been working through and undertaking, including gallbladder polyps. If you want to know about that, then I don't know anything about that specifically, but Richard, I'm sure, has a better idea of what the medical side of things there. Use cases for AI is another area where work's been going on, and just last week the OECD Paris survey, which is a superb piece of work, was published. It's a shame because the results weren't so great for Wales. The government did downplay it a little bit, but it doesn't take away from the excellent work that went on, even if the Welsh government didn't really want to shout about it this time. Then there's the VPAG and Pathfinder studies, and as well as the Simplify and Best For. So again, if you want to see more details of those, then do have a look through or get in touch. There have been some issues around recruitment. I know that the R&I team are not alone in that, but I think they are being addressed, and hopefully shouldn't generate any further risks. So that's everything around the research innovation area.
Well, thank you, Martin, and I can tell you that your independent member on the plane back from Arab Health ended up sitting next to a NHS Wales employee who had been out to Arab Health talking about a particular innovation in diabetes complication detection, and turned to me and said, "Yes, I had a really interesting app, but we couldn't do anything because of the cyber risk." And I said, "Oh, that'll be me. I'm responsible for that." I know she's going to follow up with Rachel, and hopefully there'll be some research and innovation work to do together. It sounded really interesting. David, may I ask you to ask a question?
Yeah, thanks, Rowan. Thanks, Marty. I just wonder if you could expand a little bit on the reference to the recruitment challenge we've got. What sort of roles are we struggling with, and how many different roles have we got that we're short of at the moment?
Yeah, I think this is within the research innovation. I think there was somebody who left just to have to get a new job, and I think just with a lot of the uncertainties, it's not unique to the R&I area, but just with I think a lot of it stems from the cancer area, and Michelle might want to comment on this as well. But we've had to sort of pause on a few things while we wait for confirmation from Welsh Government about the situation as regards the roles for the business as usual roles for the Canish replacement. And because that is such a large project involving quite a large number of staff, there's just been a lot of work going on. And I think while that work has been going on, there's just been a little bit of a pause in terms of advertising. But it's coming to an end now. And although Welsh Government haven't come through with official confirmation, there have been plans put in place to at least help things to move forward. So things are slowly edging forward, and we hope that Welsh Government will send over the confirmation letter of for the permanent roles, hopefully fairly soon.
Okay, thank you, Martin.
Okay.
Adrian.
Thanks. My comment would be that the Canis decommission programme moves to a product delivery, and there's a reduction in the number of staff by approximately 50%, and some funding has been provided for the next 12 months. When these are all valuable staff, we want to retain them, and we're looking at positions across various programs where they will add value. And why that happens, a redeployment of staff, we don't go externally to advert. We identify people who have a skill mix and can fit into those positions. And in the research area as well, we've had some individuals who've also not the let me get the words right here, Chair. The Change Ambassador Programme, which was funded by the DPIF programme from Welsh Government, had its funding removed. There were people who therefore were displaced by that programme, and that again has impacted on our ability to fill posts without understanding what the skill mix we have within the organisation is.
I think that's some really helpful background there, Rydian, and talks to the challenges of, how the organisation is funded more widely, just generally, in terms of delivering, normal course of business services, core business services, of which R&I is one of them, and also new shiny systems, which we do both things. Yes, Rydian, if you want to.
Yeah, I just want to come back. First of all, thank Martin for stepping in. Thank Matt Wintle for chairing this element of my portfolio. I'm most grateful, and he has a lot of expertise, as colleagues know. It's also worth noting that as we develop this area, we generate income in partnership, and that will be reflected in my department's returns in the financial review that happens at the end of the year. I can see a few people laughing. We always struggle to get a balance, don't we? I just want to note that they're doing some very good work and they're generating some income, truly adding value. Thank you to that team.
Yes, and Rydian, with a serious, very serious point there, that all of this R&I activity that happens within the function is not just driving the innovation at the digital level. There were a number of clinical trials covered on the back of the report, which is seeking to provide innovative new treatments and screening tools and things that are improving patients' outcomes potentially. So absolutely core to delivering modern healthcare. David?
Just if I may reflect on what Rydian's just said. So it shares my experience. So this is an area where you can drive significant value for the wider organisation. So it leads to, well, why aren't we doing more in this area? And the problems that you've highlighted, Rydian and Martin, around being able to recruit when there is no clarity on funding, I think it's just hamstringing us a little bit. So I would like you to raise it, Rowan, and in your escalations to the board meeting, that we're doing really good work in this area, but we are restricted in what we can do because of the funding bill. It's a known issue, but I think we need to highlight it as frequently as possible.
I think it's worth shining a light on.
Yeah.
Yeah. So thank you very much for those two reports, Martin. You've done an excellent job. And Julie, if you can make a note of David's point there, that we can bring up clarity on funding and the ability to retain and recruit staff as something we just might want to highlight. I will highlight the WASPI progress as well, I suspect. Thank you, Martin. And moving on to the Wales Informatics Assurance Group report with Laura.
Laura Beddoe. Thank you. I'm Laura Beddoe, Quality Manager. Just a few highlights from the report. You'll have seen from the appendix we've changed the format slightly, but the content is exactly the same as the previous report. Just a few things to pick up. In the Go Live compliance, when we were reviewing and drafting the report, we identified that one system had gone live before having full WIAG assurance. So that was WPOCS, the Wales point of care testing. We have been in contact with the assurance lead. They'd requested several pieces of evidence. Most had been supplied, but not all, which is why he hadn't given his assurance yet. unfortunately today, this week, well, not unfortunately, I'm both the project manager and the assurance leader on annual leave, so I can't give you an update on where it is right now. So when we identified it, we spoke to the project manager who was going to be supplying it. So hopefully by now everything will be done, and by the time they come back off leave, I'll be able to update everything. But following on from that, because we normally do the review quarterly, myself and the WIAG facilitator, because this obviously slipped through the net, we've agreed we're going to start doing a monthly review on all the projects to try and make sure that this doesn't happen again. Realistically, project managers coming towards the end of when they go live is due, they're normally very, very vocal, and they're in communication with both of us on a regular basis. So this was an unusual one for it to slip through. Another thing, another highlight, we presented, myself and the WIAG facilitator, at the EPMA, the Electronic Prescription and Medication Administration Learning Network in Cardiff a few months back. We were, I think all the health boards involved in EPMA were invited, and I think the majority attended. And I think we were invited because as the EPMA programs are going closer to go live with each of the health boards, the requirement is to come to WIAG for assurance, and the question was why. They're a locally procured system, why are they coming to WIAG? So I think my role there was mainly, my focus when we went to the Learning Network was to talk about the history behind it. So how the programme board had come to us and asked us for additional support and assurance because DHCW has so much experience in rolling out digital systems. So I mean, this was before I had joined WIAG myself, and I think talking to the programme board and members of the project teams across the health boards, they hadn't been aware of this themselves, so they just were told that they had to come to WIAG, but they didn't know why. So I think that was a really, really useful meeting to attend, to put faces to names as well. So now we have a much better relationship with the health board, of the people that we're working with. Following feedback from that meeting, they are looking at, there was a suggestion that where we had to focus on why they were coming to WIAG, maybe we could do a masterclass and bring in a few of the assurance leads and sit with the project managers and go into more detail. So there is discussions about if they were going to run a learning network to go through that again. So we do have, with EPMA, we have one health board that are majority of the way through the process. There are a few assurance areas that haven't approved yet, but we've had another two that have come to WIAG with show and tell, so we're about to start the process. Also, in the report, I've noted that we've started adding what we call AQP extensions, an assurance quality plan extension. We haven't included that in the report previously, and I thought because there were so many coming through WIAG, I would do that this time. So when a project comes to WIAG with an assurance quality plan and all 20 assurance leads have added their requirements, it has a 6-month validity. So after that 6 months, then we require the project manager to come back and to give us assurance that there's been no substantial changes to the project. So we've had quite a few have come through over that quarter. So I thought it was important to start adding those and to give you assurance that if projects are delayed or taking longer for any reason, or there are changes in projects, we should ideally be picking that up during the extension periods and having those discussions. And then finally, just a note on the WIAG Power App. So we've mentioned before that we were introducing this and that we would be running the assurance quality plan and the safety case and readiness reports process alongside the Power App. At the time of writing the report, we had 2 submissions on the Power App. We now have 8. It's an interesting challenge running the 2 systems. We are thinking of new ways that we can more communicate with the assurance leads who have done the AQP and the safety case process for quite a while, some of them, and they definitely have certain ways, embedded ways of working. So we're looking to make sure that we can support them wherever we can, different ways of communicating. So we offered workshops for project managers and assurance leads, but I think what we've found is people are preferring to have one-to-one sessions just before projects due to go on to WIAG. So people are preferring the one-on-one. There's lots of different things. We have work instructions and training videos that are being made available. There's been a lot of feedback, which we would expect of being so new. So we are keeping up with the fortnightly meetings with the Centre of Excellence team. So we're collating the evidence. We have a recurring agenda item with WIAG, and we're, going through all the feedback and making, any suggested changes. And then obviously we want to monitor to make sure that changing this process is going to add benefit. The idea was that we were going to streamline the process to a point. We already write a monthly quality report where we pick up lots of other things work that people within the quality team do. And there's a small section on WIAG, attendance and what's going through. Now, we've been working with the Power BI team. So obviously with the Power App, we can pull out so much more data. So we're working with those. They needed to wait until there was actual data in the system before they could do the reports. But we're going to have to be able to pull lots of information out to see, if it is actually speeding up, if we have streamlined the process or not. So I'm going to do that on a 3-monthly basis. So hopefully with the next report, then we'll have some starter data for you in the next reports. In the following reports, then we can see, where we've benchmarked and if there are improvements. We're expecting it to be a slow start because we're expecting people assurance leads more than anything to find it new. So they're taking their time to work through how they use the app and working through their own business as usual processes with WIAG. But we're generally it's been very positively received so far. So that's my my highlights.
Fantastic, thank you, Laura, and really clear report as well supplied to the committee. So thank you for that. Ridian, yes, would you like to?
Just put my thanks on record to Laura. I can't share everything, and I have to delegate some stuff, and she does an excellent job of. And is much nicer than perhaps I would be on the committee. She often gets scared when I pop in because I do my best to attend, but she does a fantastic job. So thank you.
I thought I hit it well, Ridian. Obviously not. I'll try my poker face.
Ridian's used to seeing fear when he's in the pre-theatre with his patients in clinic. So Laura, thank you for that. I mean, it's always disappointing when you have a non-compliance, but I think the positive here is that we've caught it, and we can monitor it. So that's to me the assurance process working. Not that we achieve 100% every time, but that we actually capture the non-compliance. So I don't think it's fair to overly question you, as you say that the key people are away. But if I could maybe ask for you to circulate a paragraph or a couple of sentences of what the status is to the committee, once you've chased that down, that would be very helpful. And perhaps we could put a summary of that in the minutes. I think that would be helpful.
No problem.
Any other comments for Laura? No, thank you, Laura. That was a really great job. So now turning to the Technical Design Authority Assurance Report. Is that Sam? Sam, I was thinking I can't see Chris, so I imagine Sam is covering for that.
I will present this one today, Rowan. Yeah, Chris Collis, our Chief Digital Architect, would normally be presenting this report, but he is on leave, probably sunning himself somewhere, so I'll cover it today. So I think we're in a regular rhythm of reporting now from the Technical Design Authority to this committee. So members will be familiar with the remit of the TDA, which is to provide, commission and assure the provision of principles, standards and blueprints that we then use to steer the development of our enterprise architecture going forward. That is done through a number of working groups that we've established, and then then making sure that designs are actually applying those principles and standards is done through the Technical Design Assurance Group, which is a subcommittee of the TDA, and then anything which can't be approved through that group is escalated up to the Technical Design Authority. Since the last report to the committee, there are a few highlights just to call out from the work of the group, so that we formally approved architecture principles in 5 out of the 6 architecture domains. So just as a reminder, we've got domains which we've established, which are enterprise architecture principles, which are the very high level sort of steering principles, things like we will be cloud first, we will be user first, that sort of thing. Then we've got more technical principles which fall into areas of open architecture and integration, data and analytics, digital workplace, cloud and infrastructure, and digital products and software engineering. So the only one of those groups which hasn't yet formally ratified its principles is the digital products and software engineering one, and we're expecting those to come to the next meeting. So we're making good progress. And then recognising the critical importance of a couple of other areas, we have introduced 2 new working groups to the committee. So we've recently established one to oversee user-centred design and one to oversee clinical design, so ensuring that the right clinical standards are baked into our digital products. We've appointed leads who are the heads of profession in those areas. They have formally commissioned their working groups, and they're in the process of establishing principles, standards and blueprints in those areas, which we will then bring back and ratify in the normal way. We've established a process for managing technical debt. So in the approval of designs, there will always be instances in which other imperatives such as speed or cost mean that we need to make exceptions to the principles that we've defined. In order to make sure that that's done with our eyes open, we record those as technical debt items on our register, and they're then tracked through so that we don't lose sight of them, and we can circle back round and address them in the future, or at least understand any risks that we're exposing ourselves to by doing that. And that's important because architecture is important, but equally, architecture has to serve business outcomes, doesn't it? So the most important thing is that we are delivering products and services in a timely manner, and the architecture needs to serve that. Some other developments kind of at a more national level. So we have been working with Welsh Government on the governance review. One of the recommendations from that is that we establish a national architecture board. We expect the work of the TDA to be informing that board in the first instance, so that many of the principles that we've established within DHCW, I think, we can roll up to a national level, and that will give that board a good starting point. It's also an expectation that there will be a kind of hub and spoke decentralised structure to that. So the National Architecture Board will sit in the middle, and then each health board, each NHS Wales organisation will run its own design authority or equivalent, and so we'll operate in that federated manner. The National Board will assume responsibility for developing national standards, but we will, as I say, hopefully use the work that we've done in DHCW to give that a leg up, as it were. And then the final thing I just wanted to highlight is around the work that we've been doing on the national target architecture. So we've been commissioned by the CDO in NHS Wales, Mike Emery, to produce a national architecture for NHS Wales. The intent of that really is to provide a blueprint which shows how digital services support the delivery of care. So what are the capabilities that exist across the system, across the health system, and how do digital products and services support those capabilities? And then ensuring by extension that we've got the right digital products and services in those spaces, and where not, we can produce a roadmap that will really set out how we get from where we are now to where we want to be in a target state. We set out an approach to doing that with some high-level milestones and a roadmap, which we shared with Welsh Government before Christmas. And then it has been indicated to us that there's some funding available in the coming financial year, which we can use to take that to the next stage. So we're now in the process of working that up in terms of understanding how we would use external suppliers to come in and do that work. Largely what we're expecting to do is to bring in a partner who would work with us and work with our health board partners to populate the enterprise architecture tool that we've recently procured with the information which we can then use to start modelling future states and to understand how we get to that. And then another phase of that work will be to turn that into a high-level delivery roadmap with indicative costs that we can then use to steer investment decisions in the future. And we aim to get to that point by September. Thank you.
Thank you, Sam. And that's a really great summary. I'm not surprised David's jumping straight in with the question. I've got one or two as well. David, why don't you lead off?
Okay, thanks, Rowan. Thanks, Sam. Thanks for the update, Sam. Really good that we've got some traction with Welsh Government around some of the work you're doing, particularly on the national architecture and the establishment of a board. I think it's the right call to use some external expertise. I just wonder whether you feel we've got all of the expertise we need in-house as DHCW to work with a partner to make sure we get the most out of that relationship.
Yeah, I think we have the expertise. I think what we are lacking in part is the capacity, because there's a lot of work already ongoing in the architecture space, and we also have a lot of the architecture community which are funded directly by programs, so they're working specifically on things like EPMA and DSPP and so on. So but we've brought in strong leadership into the architecture space, with Chris Collis coming in now as our chief digital architect. But I think what we do need to do is to scale the capacity in that area.
Yeah, I think we need to be an intelligent customer of whatever consultancy we use to help us with that. So I do feel as if there's probably a need for some additional capacity in the team, because on a couple of occasions we've sort of referred to using existing staff with best endeavours. I think as this thing grows, we'll need to support it more, and I think you will need more capacity in the team. And I'm preaching to the converted. All I'm really doing is highlighting my support for what you need to do to put that team in place.
Yeah, absolutely, David. And we're planning to use some of that funding to kind of bolster what we would call, I guess, the client side team, who will then manage the supplier when they come in. Absolutely.
Great. Good deal. Thanks, Sam.
Thank you.
Yeah, thank you, Sam. My comment really is, I was really struck when you said, that you measure the effectiveness of the architecture by its support of the business operations and giving you the capability to deliver the organisation's core priorities. And I think that is a really powerful kind of North Star in all this. I know there's a lot of excitement around architecture, and that has to, I think you have to link it all the way through to the why we're doing it this way, and also make sure that it's not just a technical discussion. Of course it is fundamentally about technology choices, but if we haven't got supporting policy wraps, the information governance that we need, you're not going to get the full value out of the architecture investment. And the architecture investment is really what will give us the flexibility and the capacity to speed up and deliver all of the things that the clinicians in the system, our peers in the health boards, government want to see us achieving. And then I think the other really important sort of information to have an open discussion with the system is about, an architecture can be as simple or as complicated as we like, but these are not zero sum choices that we make in terms of cost. So I think how we find a way of having that conversation is going to be really important, so that we get all of the benefits that everyone hopes from the having an architecture, but actually that they're delivered practically to the system, because otherwise it becomes like another magic wand, a bit like AI. If we just bring the AI or we bring the architecture, we can solve it. They're not magic wands. I'm really pleased that it's having this elevated conversation. But I think those are some of the things we need to keep front of mind if we're to deliver on the opportunity.
Yeah, thanks, Rowan. I couldn't agree more. I think I feel really strongly that architecture is just there to support delivery, isn't it? Because architecture without delivery is just drawing pictures, isn't it? Without wishing to be flippant about it, but it is. So it's got to be tied to the outcomes that we're trying to achieve, and we as a system need to understand the ambition and the vision and the scale of investment that we're prepared to make in order to realise some of these choices, because as you say, it's not a zero-sum game. There are choices that need to be made to determine what is the appropriate architecture for NHS Wales, and DHCW can't do that in isolation.
And I'm just going to call out Rydian's words of wisdom. The collect, sharing of information is what ensures safe patient care. So we have to have this kind of broad conversation, I think. So very, very good report. Thank you, Sam. Okay, so we've received that for noting and assurance. So thank you very much. Somehow we're just about on time. So thank you very much for working with me and accommodating the overruns. Thank you very much for that. Is there any other urgent business before we close the public session? No? Okay. So items for highlighting in the chair's report to the board. David asked for the recruitment to be covered in terms of the information services work and the R&I work, research and innovation work that we're doing. I'd like to call out and highlight the progress on WASPI's 20th birthday party, but more literally the impact potential of being adopted as a code with the ICO. I think that's phenomenal leadership from DHCW, and we should be celebrating that. Now, what else might I have missed? Does anyone feel that we need? Sorry, Keith. Thank you.
Yeah, I think the NHS Wales app, and that we've received the lessons learned.
Yes, thank you, Keith.
Okay.
So could we also receive highlight the fact that we received the lessons learned on the Welsh on the app? That would be very helpful. I think important that we highlight that. Anything else I might have missed that we think should be raised at board? I just want to thank everyone for some really high quality materials coming to the committee. I really appreciate the effort you make, and thank you for your engagement in the public subcommittee today. So with that, we'll close out the meeting, just noting that the date of the next meeting is Thursday, the 22nd of May. And note that we've got a 10-minute comfort break, and we'll resume at 3:15 for the private session. Thank you very much, everyone.